he went for kidney stones, and all the urologists, the patient told me, would talk about was his PSA and prostate cancer. And the patient was really turned off about it because he didn't have prostate cancer. His PSA was relatively low. The urologist kept pushing him for a biopsy, and the patient just walked out of there. He called me up. He came over to my office. I saw him. I repeated the PSA. It was 2.29, not 2.9. I reassured him he's 45. His PSA is low. He doesn't need anything. And this whole idea of getting biopsies and creating an assembly line is just, I think, wrong. We've talked about it, and we talked about the article from New England Journal of Medicine, which showed that urologists who own radiation facilities increase their referrals for radiation 300%.
Wow.
So there's a huge, it's like a medical industrial complex of people who are pushing patients to get treatment that they probably don't need. I spoke about another man about 2 weeks ago who, same story, was being pushed for prostate cancer biopsy. It was a healthy man. He was 55. He owns a fruit and produce company in Queens, had a beautiful wife. He had no reason to get a biopsy, no symptoms, normal PSA, and yet people are being pushed to get biopsies, and it's wrong. And it's part of the problem that urologists are buying radiation facilities, and then they therefore are profiting from the radiation facilities. Peter Stark created a law in the 1970s, 80s, that prohibited doctors from owning and referring to their own facilities. And this is a legal issue. Our organization called ASTRO is challenging it. Many urologists are saying that's part of their need to be able to give radiation. Our industry, our medical group, believes that it is not correct, that urologists should see the patients, and patients should be free to get a second opinion. They shouldn't be pushed into something that's wrong. So I agree with you. Long Island has one of the biggest organizations of urologists. There's dozens who have bought in. They're co-owners of radiation facilities, and they've actually in many ways destroyed the treatment field of prostate cancer on Long Island because there's much less brachytherapy, there's much less other options, and 9 weeks of radiation isn't the best answer probably for anybody, and certainly many men don't even need that biopsy. So I agree with you 100%.
Can I ask one more question?
Sure.
Okay, so, the PSA obviously isn't a perfect test. I mean, I think when you take it with the family history and the rest of the, medical history, you get, I guess, maybe a better idea of what may be going on. But what do you think about the test PCA3?
I think that we need less testing. I mean, you started your phone call is, what about prostate cancer? Are we doing too much testing? I think we're probably doing too much testing. Probably too many men are getting biopsies. Too many men are going crazy. And if you read about, and I read just a few minutes ago, side effects of surgery, too many men are having their lives destroyed by prostate surgery. I have men come into me and their wives left them. And one man said, he came in with his girlfriend. He's been with her 5 years. He said, the first thing that he said to his girlfriend, and the girlfriend told me, he said, look, I've had prostate cancer surgery, and if you don't want to go out with me, I understand. It's devastating many men's lives. So let's focus on finding the men that need it and trying to cut down on all these unnecessary biopsies and fishing expeditions into people's prostates.
Great. Thank you so much.
Thank you. God bless you. If you have other things to talk about, you can call during the week at the 212 Choices. I'm happy to speak with you. Thank you very much. I missed several calls, so if the callers want to call back, I apologize. I was on the phone with this gentleman. You're welcome to call back at 212 Choices, and I'll take your call. We have Dr. Eisen on the line, who is a Spanish-speaking oncologist who's dedicated his life to taking care of the Spanish community. Buenos dias. How are you?
Good morning, Dr. Lederman. How are you?
Fine, thank you. So we're almost at the end of the hour, but I do want to introduce you, and for people who have cancer and who speak Spanish and want to spend an hour or 2 hours going over the documents in their native language, Dr. Eisen is the man.
That's right.
That's right. And interesting about the data, because I just saw a patient that for 14 years, he thought that he has one type of cancer. And when we reviewed the whole data, he went to a major hospital in New York. Actually, the pathology was totally different.
Right. He was told he had non-Hodgkin's lymphoma, and in fact, he had Hodgkin's lymphoma, which is a completely different disease. And he had a huge mass in the neck, and he came to you. He's about 50 years old. He wants to maintain his fertility. He wants to have a chance of being cured, and you will probably have a great chance of that with radiosurgery. Excuse me 1 minute. Whoops, I missed that call. If you call me back, I'm sorry, I hit the wrong button. So, doctor, how do Spanish people contact you, or anyone who wants to deal with you? How do they find you, day or night?
For the Spanish community is 917-836-8105.
Again?
917-836-8105.
All right, thank you, and have a good day.
Okay.
I missed many phone calls, so please call me back, 212-CHOICES, 212-CHOICES, if you have a question. I'm sorry, we just had too many calls to take them all.
And you are one of few doctors who you do answer the phone weekends, nights.
Yeah, I'm nuts about that.
Well, no,
and,
that's important,
people
doctor.
that have cancer,
Yeah.
they really need to be able to speak to
That's
their
very
doctor.
true. That's
and
very
we
true.
tried to be available to them. We just have a couple of minutes. I don't know how much of this story I'm going to be able to tell you, but it's a woman who was in a car accident. She was sitting in her car in New Jersey, and she was hit by a truck a year and a half ago.
Okay.
And she ended up in the hospital for 6 months. She had both lungs collapsed, ribs collapsed. She was on a respirator. Unbelievable story. She got a brain MRI. They found a tumor, and they didn't do anything about it. And now she's coming to me. She saw her surgeon who told her she had a meningioma. In fact, it's not a meningioma. The report said it's probably a glioblastoma. So she was diagnosed a year and a half ago. Nothing was done. She saw a neurosurgeon now. He's told her it's a benign tumor when, in fact, it appears to be a very cancerous tumor. She came to us. I just want to mention that, and there's a long story which I'll probably talk about over the weekend on our Sunday morning shows or Sunday evening shows. We're just at the end of the hour, so I apologize. We have a caller who's calling in. We're just at the end of the hour. This is Dr. Lederman. We hope you have a great Thanksgiving, great holiday with your loved ones. I wish I could be with you all. We'll be back next Saturday, same time. If you have questions, please call us at 212-CHOICES, 212-CHOICES. God bless you and have a great week and a great holiday filled with a lot of love.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day, because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES. Just call 212-CHOICES, 212-CHOICES. Just call 212-CHOICES, 212-CHOICES. Just call 212-CHOICES, 212.